Recognizing the symptoms of a heart attack can sometimes be difficult, but sometimes people may realize something is wrong and either ignore the warning signs or attribute them to something else. Our daytime cardiology expert, Dr. Shobha, is here this morning to help educate us all on heart attack symptoms and why quick action is the best action when it comes to your heart. Good morning, Dr. Shobha. Thank you for being here. And that's so very true. If you think something is wrong, it is best to err on the side of caution, isn't it?
That is correct. If your body is trying to tell you something's not right with you, and you better get it checked out. I'll give you some examples. I was on call at the medical center yesterday, and I had 5 people that came in with acute heart attacks. And these are things that could have been prevented. And unfortunately, these patients had these symptoms going on either from anywhere from 3 days to 2 weeks, and they did not realize it was their heart causing their issues. And one of them was this young 31-year-old gentleman that came in with a heart attack, and he had been sitting on his symptoms for a good 2 weeks. He had this vague symptom in the upper portion of his belly, vague symptom in the chest, and he thought it was his stomach. And he was getting a little short of breath. He thought he was just overweight and, inactive. He smokes, he was blaming it on a lot of other issues.
Right.
And he actually did not get it checked out. And finally, some family member said, why don't you just go on to the hospital, let's get it checked out. And lo and behold, he was actually having a heart attack. And unfortunately, if you don't recognize it in time, you're actually chipping away a little bit of your heart muscle each time. And that muscle does not grow back. Oh. So you can go into congestive heart failure.
Right.
And you have to be very careful if you're a diabetic, because diabetics may never truly have the chest pain that goes up into the jaws, down the arm. None of these patients has those symptoms. None of the 5 had those classic symptoms. Somebody had just, pain in the back between the shoulder blades.
Right.
One of them actually had pain on the right side of his chest in the right arm. He thought he had pulled a muscle.
Right.
And he was just trying to shake it out. Very vague, atypical symptoms. But if you have risk factors for heart disease, then I think you should get it checked out, and that should be top priority.
And you said a 31-year-old. I think a lot of people think, okay, I'm in my 30s or I'm in my 40s. I'm kind of bulletproof. I don't have to worry about heart issues. That is not true.
That is not true. And especially, women are even worse than men. And they blame it on emotional issues, and women actually tend to take less care of themselves, when they are younger. We are all worried about our physical appearance. You dab a little lipstick, grab a little makeup, and we want to look young and pretty. But what's going on our insides? I've had a 28-year-old lady that I've had to send to open heart surgery. Her arteries were so clogged.
Incredible.
I mean, age is not a matter when it comes to blocked arteries. There are different types of heart disease, but I'm talking specifically of the kind that causes heart attacks. And women are not immune to heart disease at a young age. There are things like family history. If you have a bad family history, you need to be checked out early on, and you need to take steps right from a young age. You're 10 years old, you're in your teenagers, you need to start eating right from that age. There's a simple tool that something called Know Your Heart Age.
Right. And I've seen that online.
Yeah, and that is something that is very interesting and important because you may be, say, 20 years old, but your heart could be 40 years old. This gentleman that came in 31 years old, when you calculate his heart age out, it's probably 50 years old.
Incredible.
And if he had taken steps in his 20s to take care of his heart, if he was even aware that his heart could cause a problem, he could have been saved so much aggravation at this point.
And you said there is a way to check to see if there are blockages without actually doing a heart cath.
Correct. First, we start with simple tools like EKG.
Right.
One of the gentlemen actually yesterday, we did an ultrasound on the bedside and it showed a low pumping function, so we knew something was wrong with the arteries of his heart. We do simple things like stress tests to pick up blockages. We also do something called calcium score to look for calcium buildup in the arteries of the heart. We do blood tests to look for heart attacks. And last but not least, we do a heart cath where we actually go into the arteries of the heart and take pictures. There is another tool called a non-invasive heart cath where we run the dye into the arteries of the heart on a CT scanner without actually doing any invasive procedures, and that can also tell you if you've got blockages or not. But you have to pick which test is correct for you.
Right. And the first thing you've got to do is recognize something is amiss.
Yes.
And it may be something as simple as a pulled muscle, but
yes,
it's important that you get in and make sure.
Yes. And the thing is, don't drive yourself to the emergency room. There was one gentleman that actually drove himself to the emergency room with his young 9-year-old son. He actually did not even make it. He came to the emergency room and he crashed. I wish he had called 911. He knew something was wrong, but he took it upon himself to drive to the hospital. Please don't drive yourself. please dial 911.
Right. And you're saving, not only saving your life, you're saving someone else's as well.
That is right.
All right, Dr. Shobha, thank you so much.
Thank you.
And next month we're going to take a look at heart age. We're going to do those. We're going to do the checklist that she was talking about, and you can find out for yourself how old your heart is. And if you need more information, there's a number, and down there at the bottom of the screen, and heart.org is another great way to find out more about your heart health.